So nothing is written in stone.
Yeah.
You know,
Just
this
kinda
is the
trial and
jumping off.
error in a way.
Correct. Not every chemo agrees with every patient. So if you're having trouble with these, you know, he can switch things around too.
Okay.
So, you know, so that's that information. And like I say, there's just some other general information. I was going to just give you a
Yeah.
quick peek. This is what the port looks like underneath
Okay.
your skin.
Wow.
So it'll sit right
I'll feel it.
underneath.
Oh my gosh, this
It's-
grosses me out.
Well, it's actually just like a little bubble.
okay.
You really won't feel it much.
Okay.
They do a great job. They're going to make a little incision. He's going to take his finger, kind of tunnel it. They put this in and then they thread it up through your neck and it sits right at the top of your heart. Like the doctors say, this is like the chemo going into Niagara Falls.
Oof,
I mean,
okay.
it just goes right into your system right away. Chemo can be very toxic on your veins. And then, of course, each time we have to dig for a vein when you come. So all of our patients get ports.
Yes.
This
okay.
will heal over, you know, so you'll just have a little bump there.
Yeah.
When you come in, the nurses will access it, and the needle that goes in is kind of shaped like this, so it goes in like this, and then it lays flat, and then they put a dressing over it.
Okay.
It has a little pigtail that they'll clamp off. So when you come for your lab, they're going to access the port, put a little dressing over it, open that up, take your lab out, clamp it off, send you to see Dr. Cross. He says, yep, you're good. Send you back for chemo. They unclamp it, give you your chemo, and then when you're done, they flush it with a little heparin to keep it from clotting, take the needle out, put a Band-Aid over it, and you're on your way.
Okay.
You can draw your labs, all of those things through it. So they are very, very nice.
Yes.
Once you
that's
get
what I
it in,
hear.
once you get it in, and it really saves a lot of poking and prodding. Right. Yeah. So.
I can do lots of hard things, but anything with like blood pressure, blood, it all makes me feel a little woozy.
Woozy?
So
Okay.
I hope they give me a really great cocktail today.
Oh yeah,
because-
they'll have you draped, so
Okay.
you'll be looking, you know,
Okay.
this way. I'm guessing. Yeah,
and not
so-
feeling anything.
Correct. Yeah. So talk with them. Our interventional radiologists are great, so it shouldn't be a problem.
Wonderful.
Yeah, they'll take good care of you. And then today, once you're done, you know, you'll be here a couple hours. You know, they will leave the needle in because you're starting your treatment tomorrow. We don't want to access that fresh area, so they're going to put a big dress. They're going to curl up that tubing and put a big dressing over it.
Okay.
So no showering, anything like
Yeah,
that tonight.
that's just fine.
You know, you could certainly take a bath if you're not going to get that area wet or whatever.
All right.
And then they'll access that tomorrow. And then once you're done with your treatment, they'll take it out. And when when they draw your blood and things, certainly don't have to look. You know, they can drink it. So.
Are you
Going.
videotaping?
Yes.
All right. I just had a really good nap. It was wonderful. For one, we were talking about our kids being in school, and my nurse, Luke, he has 2 girls, about my kids' age, and we were talking about that, and then before I knew it, I was like, we're done. I didn't have to be nervous or scared about anything. So I have a port now.
Yummy.
Now, when I go into chemotherapy starting tomorrow, they just plug into the port. And when I don't even want to know what the port is connected to. It's like all my big veins, and it makes me feel a little lightheaded to think about. But I literally just got back up here. When they need to take blood and stuff too, they'll take it right from that area.
Oh,
Yeah. But then when they put the chemotherapy in, the cancer destroying drugs, they said it's like pouring it into Niagara Falls, and it'll just hit my body a lot easier. So I'm gonna get my own gown though for if I ever have to do this. I'm not wearing this stuff again. It's like, let's make people look absolutely disgusting. Pour fluorescent lights on them. And then, yeah.
Did you get a bright pink one?
Maybe bright pink. Maybe a nice blue.
Blue is hospital color. Should I stop?
I'm not. We're all good.
I'm good.
Why am I closing my eyes a little bit?
so tired. Should I go get Granny?
Here, all right. I just turned it on. I'm at the clinic. I'm getting my genetic testing done, and because I have a port, I don't have to do it I don't have to get blood drawn through my arm. The port is connected. What is the port connected to exactly? It's like my main arteries and stuff. It's gross.
Yep, it's actually going right into the main aorta, or the
Okay.
vena cava, I guess. It's the biggest vein that you have in your body, so it's a huge
Wow.
vessel that connects right to the heart.
Wow.
So, yeah.
Ugh. I mean, I'm like, I always say, like, I can do hard things, but like anything associated with like blood pressure or the heart, I get a little bit. It's just so weird to me that this thing is connected to my heart in a way.
Totally.
Yeah, it's just different.
It is weird, for sure. Do you have any sensitivity to dressings or the cleaning?
Nope.
Okay, so we're gonna start with cleaning. We try to keep it as sterile as possible, so I wear sterile gloves and a mask so I'm not
Okay.
breathing on the area. Is it tender at all?
Nope.
Okay. How long have you had your port?
My port placement was beginning of June,
Okay.
in there sometime. I sure didn't like it at first.
Okay.
I think it was more so a mindset. Like everybody kept telling me, "Oh, you're gonna be so thankful you have a port. You're gonna love your port." And I was like, "Well, I'm gonna just not like it."
Yeah.
But
Yeah.
it wasn't. It kind of felt like I had a dull steak knife just pressed against me
Sure.
for a very long time,
Sure.
and now it's not. So I'm getting used to it, I think.
Okay. Okay. So we clean for a few seconds.
Okay.
Make sure it's nice and clean. The stuff right above the actual port, that's just skin glue, and eventually that will fall off.
Okay, I
so-
was wondering about that because it's kind of changing shape and
Yeah.
stuff, and I thought, when is that gonna come off?
Yep, it should fall off on its own.
Okay.
Don't pick it because
Yep, nope.
it should just stay.
I stay far away from my port.
Okay, so this is cold spray. It's kind of, I don't know, we kind of call it frostbite in a can, but
Okay.
it totally distracts from the needle going in. So
Okay,
we'll see
very good.
how that goes. We spray. Sorry.
You're just fine. And for anybody else going through this in the future, I did get a prescription for a lidocaine. I think, is that the term, lidocaine? A cream. I walked into the waiting room last week, and a girl had it, so I took hers and put it on, and I didn't feel anything going in. But
Perfect. Are you ready?
yep. I'm
Okay,
ready.
so I hold the port in place and I feel the 3 dots, and I'm gonna go 1, 2, 3, and we're in. How was that?
Nope, totally fine.
Awesome. So we flush it first with 5 mils, and then we draw back to get blood. We do a waste vial to make sure that whatever was in the port, we've flushed it through, so we get rid of that. And then
So then this is what we do when I come in for chemotherapy as well. Like they do blood draws this way, and then they also, the port is where I receive my chemotherapy. They hook me up and,
yeah. So we have our own little vacutainer, and it automatically pulls the blood into our lab vials, so that makes it super convenient. I'm drawing 2 tubes today for that genetic test.
thank you so much for being so comfortable with me recording this.
Oh, I
Not
think-
everybody appreciates my desire to document, so I appreciate it.
Well, I think it's important.
Yes.
There is an awareness that I feel people need, so. Okay, and then we flush with a good amount of saline. So I'm gonna flush 2 syringes of the saline here. I know you taste it, don't you?
So when she does that, it almost is like a breath mint in my mouth, like
Oh, interesting.
Yeah, I don't. For me, it's almost like a minty, almost.
Weird. Some people say it's like metal flavored, or even like a cool sensation.
Yeah, cool. I'd say. I'm glad I'm not feeling that metallic right now. But.
What's interesting is...
And then there's like pressure too.
Oh, is there?
Just
okay.
a little bit.
Okay. And that's probably from how hard I'm pushing it in, but
Okay.
we kind of want that to
Okay.
really clear out the line.
Gotcha.
Make sure that no blood kind of sits in there and clots over time. So this is heparin, and this is just what we put in the port while we're not using it, so that nothing clots off.
Okay.
So we're going to push that in. You might taste this as well.
Yeah, it's like...
Done.
You know, it's like as humans, we're like not supposed to feel our heart, really. You know, it's like I'm like aware of it right now.
You're like, I can feel it.
I can feel my heart.
Is the Band-Aid okay?
Yeah.
Okay.
And then, are you a lab technician?
I'm actually a nurse.
Oh, you are?
I'm an infusion
Okay.
nurse.
Oh, you're
Yep.
an infusion nurse. Okay, very good.
Yeah. So then we just pull it out by holding the base. And then we're going to pull it out in 1, 2, 3. Done?
Okay.
And then sometimes it bleeds, but usually we never see it bleed. And put a Band-Aid right over it.
So, and then is to learn how to do that, is it basic? Do all RNs know how to do this, or is it like an extra training that
It's
you
an
need to get?
extra skill. I mean, most RNs could do it. Like
Yeah.
we have the ability to do it,
Yes.
but whether or not we've been trained to do it is kind
Okay.
of specialized to the cancer world. So
Wow, very good. Well, thank you again.
you're welcome.
Appreciate
You're
it.
welcome.